Welcome to another episode of Follow the Brand TV. I am your host, Grant McGaugh, CEO of 5-Star BDM, a 5-star personal brand and business development company. I want to take you on a journey through another deep dive into the world of personal branding and business development using compelling personal stories, business conversations, and tips to improve your brand. By listening to the Follow the Brand TV series, you will differentiate yourself from the competition and build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build confidence, and reflect who you are. Building your 5-star personal brand is a great way to improve your skills and knowledge. If you have any questions for me or any of my guests, please email me at grant.mcgaugh@5starbdm.com. Now, let's begin with our next episode on the Follow the Brand TV.
Five-Star BDM, Brand Development Masters, is a professional consulting and advisory group keenly focused on business development services for the small to mid-sized business and entrepreneurs. Although every business is unique, they often share business development challenges that can be addressed through smart branding. Services include process improvement and operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our business and personal branding company has helped a number of professionals and organizations to optimize and grow. This results in more business, more opportunities, better reach, positive outcomes. Visit www.5starbdm.com today to learn more.
Infection control and nursing for over 30 years. It is truly my passion. I love being able to see people who are in need go into a facility and get quality care, have quality outcomes, and don't leave with anything they didn't come in with. J.A.D. Infection Control Expert is really about having the ability to partner with facilities, partner with organizations who may not have the resources to be able to make sure their residents or patients, depending on the setting, get the best care that they have. What we're finding a lot of times is a lot of people are wearing many different hats, and staffing is hard right now. And COVID did a whopper on all of healthcare, and everyone is hurting. So I come in, and our organization, we're here to be that support system for them, to provide that extra pair of hands, the innovation that they need for efficiencies, things that are going to make the difference in what happens. And we don't come in when the surveyors come in. What differentiates us is we're their partner. So when you get us, but we're helping you proactively monitor, proactively engage, proactively look at real-time information so that we can make the difference ahead of time.
Hello, everyone, and welcome to the Follow Brand Podcast. You know, a lot of times I'm all over the country talking to a lot of different people, but I don't always get to bring it right back home. And we're right back home right now with one of my favorite people. I've been working with Joy McMillon now for the last 3 or 4 months. She's really been giving me a lot of great information about infection control or infection prevention control. I mean, these are big words, but I tell you one thing. If you haven't heard of this, it's called HAI, Hospital Acquired Infections, which a lot of people do not know. In a lot of cases, is the 4th leading cause of death in the United States. This is huge, huge business, something we should all be aware of. And Joy is the person we need to talk to, how we can reduce these types of things from happening in our healthcare system, specifically in skilled nursing facilities. So I'd like to introduce Joy. Joy, you'd like to introduce yourself?
Yes, thank you. My name is Joy McMillon, and I have been in infection control and nursing for over 30 years. It is truly my passion. I love being able to see people who are in need go into a facility and get quality care, have quality outcomes, and don't leave with anything they didn't come in with. Because like you said, we're here to protect them, not to harm them. So that's what I'm all about.
That is so important. I definitely don't want to go into the hospital with one thing and come out with a whole nother thing. That is a bad choice, a bad outcome all the way around. So you have a company, JAD Infection Prevention Control. This is important. I want you to tell the audience about your business and why it's special.
Well, JAD Infection Control Experts is really about having the ability to partner with facilities, partner with organizations who may not have the resources to be able to make sure their residents or patients, depending on the setting, get the best care that they have. What we're finding a lot of times is a lot of people are wearing many different hats, and staffing is hard right now. And COVID did a whopper on all of healthcare, and everyone is hurting. So I come in, and our organization, we're here to be that support system for them, to provide that extra pair of hands, the innovation that they need for efficiencies, things that are going to make the difference in what happens. And we don't come in when the surveyors come in. What differentiates us is we're their partner. So when you get us, but we're helping you proactively monitor, proactively engage, proactively look at real-time information so that we can make the difference ahead of time, so that you can see the decrease in their infection rates and things like that. And not just that, because you got to understand, when people come into a facility, not all of them are coming in free from infection, right? Some of them are coming in with infections. And so our goal is to make sure that we properly make sure their infections are treated with the proper care, the proper resources, the proper antibiotics. But we also don't want that spread of infection to anybody else who came in without infection. So that takes a hands-on approach. It takes a collaboration. It takes partnership. And that's the difference between somebody like who's trying to do this in a different realm, right? And they'll be there when survey's there, but we're there to prepare you every day. Every day should be a survey day. Survey is what everyone's scared of out there in healthcare. We don't want the surveyors to find it, right? However, if you do the things every day and you're there and you're present and you're able to do the monitoring, track the data, make sure things are being done right, you don't have to worry about survey day. It's game time every day.
Well said, well stated. in pointing out the differentiator which JAD brings to the table. Now, you also work with APIC, and I think you are the president here of the chapter in Florida. A lot of my audience we don't know what APIC. What is APIC, right?
So you have WHO, you have the CDC, right? And then you have APIC, which is the Association for Professionals in Infection Control. So in Miami-Dade, I am the chapter elect president. So as of next January, or actually December, I will be the next APIC president for Miami-Dade chapter. I do a lot of my work with APIC is hand in hand, because always staying on top of the most evidence-based guidelines, the best resources that you have, always in the know. We're in constant communication. We're the ones lobbying for more of us to be in the buildings, to be able to service the people entrusted in the care of all of the healthcare companies, right? So I have my role there, and that's a volunteer role, and I love that, because to me that's giving back. And part of who I am and part of my core values is to be able to give back to the community, make sure that the community at large is taken care of. And a lot of who's being left out right now are the long-term cares. Like if you look at the APIC membership, 90% of it is all about hospitals. Why? They've got the money. So they've got the IPs out there to be able to do that infection prevention. Long-term cares, the SNFs, they don't. And so the first thing I did when I got on board as chapter elect president, I was like, well, let me do some lunch and learns and provide that as a service that we're giving for our long-term care communities. Love doing that. It's a passion of mine, and I know they have the need. My other relationships with APIC, I mean, I've worked and still do work with APIC as the organization. I'm also a member of APIC Consulting Services, so I provide through my company, I contract with them, and it's just a win-win, because you have a wealth of resources. You can provide the information that everyone needs, but they just don't know where to get it, or they don't have the time, because like I said, they're wearing 4 or 5, 6, 7, 8 hats. And these are the times people think COVID is over.
Yeah.
Man, I tell you, it's not. So we're trying to make sure that we're there. And as my company, the ties with APIC as an organization as a whole, they are all about what we stand for, which is making sure that people are prepared for whatever comes their way.
Well said again. Love the relationship that you have with APIC. You now have rebranded. You've come out with this new brand, and I have to say it looks beautiful. What you've done, and you've really focused in on your niche. And you just talked about skilled nursing facilities as being a part of that, because you feel they're underserved and they need these types of services. Talk to the audience more about the premium services that you have, so they truly understand your value proposition and what you're bringing to the table.
So the premium services that I have that I can bring to the SNFs, and like I said, they are underserved. However, the need is there. My commitment is to be there in the facilities with them, letting them see the value that they're about to gain. And in the healthcare field, they have something called going in at risk. And, as my career advanced and we were looking in our particular organization to find new partners, one of the things that separated partners from others was certain facilities were like, okay, I want this partner because they're willing to go in at risk. So part of my commitment and part of my um, strategy is to let them know how committed I am to their success. So if you don't hit the targets that we came up with, because it's all about the client, it's all about their needs, what they are looking to, um, their goals, right? That's my I would say my best um way to be able to serve anybody is to know what's important to them first. And then once I get there, my commitment to them is I'm going to help you achieve these goals. And if I don't, there is a financial return that you're going to get on your investment because I'm committed, and that shows them, number one, that I have that commitment, that I'm going to be present. I'm not just going to show up when it's survey time and say, here, hand them this document, here, hand them that document. I'm there with the staff. I'm doing mock surveys. I'm giving them that just-in-time training as needed so that when the time comes, they can be successful. They can see the return on their investment, and it's just a win-win. And it's a model that I know that there are companies that are out there, and they do what a piece of what I do, which is they want to help, right? But their help is more reactive. Oh, the surveyors are there. Oh, give them this, give them that, and they're canned. That's not what I do. I tailor the plan to my commitment to what your needs are, and then I follow through with that. And I'm working hand in hand with them. I'm attending their QAPI committees. I'm attending their pharmacy and therapeutics. I'm providing them reports with their physicians and their prescribing patterns, because those things make a difference. And at the end of the day, it's a return on their investment, because the less hospital-acquired infections or healthcare-acquired infections, because we're not always in the hospital, we're in the SNFs, right? The less you see of that, right, you're saving your quality outcomes. Quality outcomes affect their star ratings, which affects their finances. You're spending less on high-cost medication, antibiotics, when you don't really need to use them because you're using them for someone it's not appropriate for. So when you do all of that and you put it all together, I'm that one that is willing to step out and say, this is what I want to do with you. And then I commit to it. And we go down that journey together.
My name is LaToya Watkins, and I am a health administrator. I've been in the healthcare field for about 15 years. So I'm excited just to go through my different stages in my career, and I'm very excited about how my future looks in healthcare. I'm really happy about how we are really using the tools and the technology in healthcare. And really excited about, the future of technology in healthcare. I know we have some healthcare affiliations right now in Congress that's kind of advocating for us to use AI in healthcare. AI is the future in healthcare, I think.
And think about in your role, and think about how you were impactful for patient, that you were able to do something that changed the outcome because you got involved. Your experience rings true. And I know because you sat on both sides of the ball. You've been a director of nursing. You know what they need what their experience has been.
Yes.
You know what the pressures are from management. You know what the pressures are from those who come in and have these surveys and these outside agencies and things of that nature that you've got to be compliant around. Now, you also do staff training, I noticed, a lot of things that you're doing. Talk to us a little bit more about what you're doing from a training perspective and how that's valuable to people that run skilled nursing facilities.
So for staff training, number one is making sure that all of the staff that are in the infection prevention role are competent, right? And competence can be done a lot of ways. And so giving them the tools, shadowing them to see what their practices are, making sure that you mentor them through that role, giving them education that's going to get them more competent. And then the sad thing is a lot of times people don't understand, they're taking that role on with something else, or they're just put into the role because they didn't have anyone else. And it doesn't just end with them. It really starts with the leadership, because the leadership has to really understand why there is a need, right? Mm-hmm. If they can put two and two together and understand how, if you empower this one IP to be able to do the job that needs to be done and do it successfully, you win as an organization. This is worth the investment. That person is worth the mentoring. Mm-hmm. And then you don't end up with them. Then you take it to the frontline staff, because as you're doing mock surveys, it doesn't do any good to just write the facility a report if you're not doing just-in-time training. Hey, I noticed you did such and such. This would be a better practice. And this is what is the established practice for that. And, you form those relationships. The staff ends up not seeing you as that outside, oh my God, here she is again. No, they welcome, because they know you're giving them knowledge. You're empowering them to make a difference, because the reality is nobody wants to cause harm.
Yeah.
It's them trying. They're short-staffed too, so they're trying to do the best that they can with the time that they have to provide care, and sometimes that means taking shortcuts. Mm-hmm. How do I know? I was a CNA. I was an LPN. I was an RN. I was that DON. Every step of the way, I know what shortcuts people take. And so it allows me to relate with them and just, hey, let's tighten up on this, because this can cause that, and then that can cause that. And putting that correlation together, because most of these people that are out there doing the good work, they care about the residents in their care. They really do. And they don't want to cause harm. But you just have to put it together for them.
You've laid that out very, very well. And I love that. So we've talked about some of your core premium services. We've talked about your staff training and how you do it differently. I'm trying to understand, there's monitoring, there's reporting, and then there's audits. Help us understand how all that comes together. And I'm calling audits, maybe surveys and audits are the same thing. Like if you don't have good monitoring reporting, then your audits and surveys are going to come out a different way. Talk to us about those things.
So you've got monitoring. Monitoring is, when I say monitoring, monitoring needs to be done real time. There's real time monitoring of data, and that's why, really anything in science is data driven. If you really want to make outcomes different, you've got to know where your baseline is, right? So you utilize that information. That's one part. The second part is, you've got monitoring, you've got reporting. Well, when you're looking at data, you're trending, you're seeing where you are, you're giving real-time reports so that in a quarter, you can see what changes have been made, positive or negative. Where do we need to go? Where do we need to focus on? Monitoring can also be in-house. And so when we're talking about, you said audits, surveys, all of that is a part of the services provided, because mock surveys or audits, because audits could be of patient records, resident records, to see whether or not did you, as the physician, provide the right antibiotic at the right time? Did you switch them from IV to oral so that it's less cost on the facility, but you're getting the same outcome for the resident because that's the standard of practice? So providing those physician report cards can be an eye-opener. It's also great to have when survey does show up. But better than that, it changes the outcome financially for the organization that needs it. So it's a win-win, and it's a way to approach it as a holistic approach and not just, okay, I'm just here to come in, do a little education, do some audits, give you some reports, and step back away. No, you actively participate. And sometimes that means educating the administrator, like I said, on what it means to his bottom line. That's really what comes to play. I mean, healthcare is healthcare, but everyone is financially struggling, and no one's immune to the effects that COVID has had on everyone. Absolutely everyone.
And it still has an effect, even though a lot of people, you're not seeing the death rates that we did when it first came out. But COVID's still out there. You hear about it all the time. Oh, I got COVID. They're down. It's become like, a cold, a flu for a lot of people. But some of these other people, it's still very detrimental, especially if they have comorbidities.
Talk about it right now, because you're talking about people with cold and flu symptoms, but the CDC recommended that since the 23-24 vaccine came out, that came out, I believe it was last September or October. However, then they came out in, I think, April and said, if you're 65 and above, you need another dose. Why? Because those are the people with the comorbidities. Those are the people who are suffering the most. To prepare them for the summer surge, which is here, not just is it here, but it is swinging in full effect. So you're not seeing the deaths that you used to see, right? Mm-hmm. However, if you look at the COVID data tracker right now, the deaths are increasing every single week.
That's news.
And these are the elder population, our population, the SNF population, the long-term care population, the people over 65 who need the care, right? So if they don't get the proper care, let's say they choose not to be vaccinated. Just because they made a choice not to be vaccinated doesn't mean, if we don't use standard precautions And standard precautions, understand me, are the basic precautions, right? So that's me treating everyone as if they had a healthcare infection, right? Everyone had an infection. So if I just do that and wash my hands and do good hand hygiene, and I don't go from person to person and not do the proper precautions, such as hand hygiene, which is a big thing when it comes to infection control. That's one of the places we've known we failed for many years, and the pandemic just brought it to a head.
I pull from, my purpose and strength is with federally qualified health centers and community providers that are really the boots on the ground, helping improve care and helping drive those better outcomes for patients and the communities that they live and work in. We're definitely in an exciting time. I think everybody says that because healthcare is always changing. But from a digital perspective and a technological adoption standpoint, there's a lot of movement in healthcare.
Grant McGaugh, CEO of 5-Star BDM, is turning heads in the healthcare and information technology sectors with his groundbreaking approach to personal branding and business development. By challenging conventional strategies, he's setting a new standard for how executives present themselves and their businesses to the world. McGaugh's expertise isn't just about standing out. It's about strategic guidance, generating leads, and building networks that propel executives beyond their competition. His focus on authenticity allows leaders to leverage their unique stories, driving exponential growth and success in their industries. Beyond branding, McGaugh is a fervent advocate for diversity, equity, and inclusion in the workplace. He's committed to helping organizations cultivate environments where innovation and collaboration thrive through inclusive cultures. And for those eager to dive deeper, McGaugh hosts the Follow the Brand podcast. Here, he unpacks the intricacies of personal branding and business growth, offering valuable insights for professionals eager to redefine their identities and share their narratives with the world.
Let me ask you this, because there's a lot of what we call FAQs, right? Frequently, asked questions. And this is where you get education, right? The people just don't know. You don't know what you don't know. Because you've been in this field for a very long time, what are some of the common questions that are out there, and what are your answers for them?
So some common questions are, some people, again, will talk about COVID. Common questions: why should I take the vaccine? I'm young, I'm fine. People don't understand long COVID, right? It's a thing. You can have athletes that have been running marathons that can't even make it up a flight of stairs. Another frequently asked question is, oh my goodness, the mask. Do I have to wear the mask again? Like, we're done with the mask. The reality is, if you took the simple things that we learned through the pandemic and took them through, you would actually realize it's not that hard to be compliant. If you're in an area and you know that COVID rates are up, because, they don't talk about it a lot, but the people that want to be in the know, they'll pay attention and they'll talk about it on the news every once in a while. However, masking is something you should do if you're in that particular environment. So if you're at an airport, you put your mask on. If you're around someone who's coughing, I'm pulling that out and putting my mask on. It's just things that people don't understand. Healthcare acquired infections. People think, hey, I've got this type of, I've got a cold. I don't feel good. They're going to their doctor. Well, okay. Prescribe something for them, right? Prescribe it. They want it. Prescribe me that. And we're like, no. Something called antibiotic stewardship. Antibiotic stewardship means if it is a virus, a regular virus, I can't prescribe an antibiotic for that. It's not going to do anything for you. But what it will do is cause multi-drug resistant organisms, which is your MRSAs, your CREs, your VREs, and those things, Candida aureus, which has no treatment till this day. And that's a huge one. People don't even want, they get Candida aureus. It has no treatment. And all these things that have no treatment are a domino effect of improper prescription of antibiotics throughout the years. And so your body builds up a resistance, and that's what it is. And so what ends up happening, now you're in the hospital, they determine you've got Candida aureus, and the skilled nursing facilities aren't prepared. So they don't want to take you. So the hospitals are stuck with you because they can't discharge you like that. They got to have somebody take care of you. We have to have plans in place for that. So these are some of the things that people just don't understand. And so you'll get asked questions about, well, why aren't they prescribing? No, they're not supposed to prescribe for that. It's really not going to help. It's actually going to hurt them in the long run. So you have to be that expert. You have to do the research. You've got to pay attention to not just the research, but innovation. There's so much going on right now with even AI. Yeah, I just signed up for an AI conference that's taking place, I think, in a week or so. But if you're not continually evolving and continuing to use innovation to help efficiencies for organizations, to help for people to be able to do things with less, which is the goal. Because at the end of the day, if I save a nurse 10 minutes from hanging an IV when she could have walked in and gave an oral medication with the rest of their oral medications. Come on. That's time saved. That's efficiencies. They could be using that to actually take the time to provide proper infection control techniques. It ties in. So I'm a big component of regulatory compliance. I love that because it ties right hand in hand. It's about patient and resident safety. And it's about why we do what we do to make sure.
Well, you're doing a great job because of your experience and you understand implications. I like that. That's what I got out of that. When we started talking about this, about a hospital-acquired infection, HAIs. And you've been working through the APIC organization, volunteering with them for a number of years. They have resources to help to bring these numbers down. And you talked about some quick wins. You bring you in, we hire JAD. Hey, we need Joy and J.A.D. to come in. And you know how to get them to some quick wins, some great ways to save money and to save lives in the long term, right? So you have a better patient outcomes. Talk to us a little bit more about APIC and APIC resources.
APIC is, so the benefit of being so involved in APIC is that they have so many resources because their goal is the same as what my goal is. They want people to have what they need to succeed. They have infographics you can post. They have education that you can utilize. They have tools that you can utilize to track infections. They have toolkits for all emerging diseases, and they allow you the ability, as a partner of APIC, you've got the toolbox right there. You've got these pre-built things that you can then determine what is going to best serve this particular organization and their needs. You utilize those, and these are, like I said, these are not, we're not just creating things. It's about making sure that the latest evidence-based practice is embedded in whatever tool or resource that is. And so the breadth and scope of that and what they bring to the table, it brings me joy to just be a part of it. And I love the fact that, we just left a conference and meeting up with, certain people that you know of, because all the greats know the greats, right? That's like world leaders, right? When in the world, who's out there, who's who, right? Who's who of who. And, the opportunity I had to meet some of the people that I've been working with, and because everything's remote now, right? So we're all remote, and we're doing webinars for long-term care and things like that. And we're doing all these things. And it's like, oh my God, this is you, this is you, this is you, this is you. And you have that connection, and then you start bouncing things off of each other. And it's just an overall learning experience and continuous life learning. That's the only way you can succeed if you are really trying to make an impact, right? You have to keep it up.
Follow the Brand TV broadcast host, Grant McGaugh, as he visits with top executives and entrepreneurs to find out their secrets of success with their personal brand. Follow the Brand TV broadcast host as he focuses on brand development to build better relationships, bring value to your business, relationships, and career. You will enjoy listening to each episode that is tailored to speak to you directly. If you're looking for this type of clarity in terms of building your brand, you have tuned into the right station. Each episode will help you to shape a conversation in the 5-Star BDM network of 20,000 professionals and become a springboard for your corporate engagement and business opportunities. Each guest will frame their story in the areas of personal branding, business development, career development, financial empowerment, and technology innovation. Grant McGaugh explains why he is the CEO and owner of his own professional career. Grant is an accomplished business leader and entrepreneur who wants to give back to individuals to grow their personal brand strategy. Tune in as he weaves his story about new possibilities, while to you exceed expectations. If you love storytelling, this show will make for fun.
Exciting time to be in digital marketing with the advent, the explosion of generative AI chatbots. They're better known as ChatGPT. There's Bard, there's Claude, there's all kinds of this new one came out called Gemini. There's so many different tools that really what it comes down to is that it's made my business more precise. I can do things more quicker, I would say, and to elevate my brand messaging to a level that allows me to be as creative as possible. Digital market economy is taking the world by storm, probably over the last decade or so, but is really escalating now in the advent of AI because it is a game changer for a lot of businesses. It's not just all the big boys that can play in this space because of cloud computing, because of mobile computing, and now you have these tools at your disposal. You've got a laptop, you've got a computer, you can now digitize yourself to a level and get your message out there, and that equates to business. Well, you've made a tremendous impact in the world of infection prevention control. And I want the audience to know your origin story. I don't think we talked about that as much. So talk to me as if you were going to give me an elevator pitch on JAD Infection Control experts. And you say, and I'm just asking you, Joy, interesting, JAD, tell me more about that. What would you say?
That would be a wonderful conversation because then I get to talk about how I got where I am right now. And really it came down to, I had been working in infection control as a director of nurses, even prior to becoming a director of nurses. So throughout that experience, I was doing all of that, and I had a facility that, I was running, but I wanted more. I had a dream, and my dream was to be able to provide services. And at that time, I was really focused on education because I love to educate. And I wanted to get out there and try to do something on my own. And so came up with the name. People wonder well, JAD, what does that stand for? Well, I'm about family. And my name is Joy. My daughter's name is Asia. And my son and my husband's name is Daryl. So it was a family thing. And so I brought my family into the name. However, I began to just get out there, and what I saw was the need was so great. The need was great. There's a gap in the education that was needed to be had, because most people, like I said, they take the role on, but they're just trying to get through. But they don't know what they don't know until, right? And so when you're able to do that, it brought me such joy. And as I continued along the path and as I grew in my role, I mean, I ended up, I think, 20 some odd years as a DON. So, and along that same path, I had been doing the consulting on the side. So for me, I was able to take all of the expertise, and then eventually I ended up becoming the hospital administrator, assistant administrator, and by doing my MBA. And so I was able to then branch out a little bit more in my offering, right? So now it's not just about education. It's not just about mentoring. Now I understand what it is your bottom line means to. I understand how I can affect change. I understand how efficiencies are important to an organization, and how all of these things and the regulatory compliance tie in. And then I can come in from a whole different perspective and really evaluate your organization and bring to you what many never thought they needed. But you don't know until you know. And so being there, being in the role, knowing because I was in the role, I knew what we needed. And I knew we weren't the only ones. I wasn't alone. But I made solutions.
Well, that's what's so important. And you've been giving us your solution today. There's a huge challenge out there in skilled nursing facilities that you just stated, just HAIs in general. You are solving that. You are a champion in this world doing infection prevention control. I encourage anyone and everybody to go to JADICC.com. I believe that's your new website. Is that correct?
It sure is. Definitely my new website. Rebranded.
So there was a before and there's an after. And from my experience and seeing what you're able to do is that you're able to showcase your particular expertise. And you've been doing that at a super high level. Before I let you go, I want you to, if there's anything that we have not talked about that you feel that is definitely important that you want to leave with the audience, what would you say?
Well, I think you've actually missed something, because I wouldn't be where I am here today, of course, not on this stage, however, not in my current business projection and my current business model without working with you. One of the things that I have to say is that it has truly been a journey, and that journey has allowed me to understand what my strengths were, what my weaknesses, where my best audience really is, and where to focus my attention, and how to rebrand so that I can be everything that I expect to be. And so I want to thank you for that, because we've been talking about me all this time, but you have been a part of that, because we have gone down this journey step by step. And it's a journey that I'm thankful for. And at the end of the day, when I win, you win, just like my clients.
Absolutely. And I want to tell the whole audience, it's so beautiful, because all of this is within Joy. I could see it, but I needed her to be able to see it. So we walked through a brand assessment. We walked through a skills gap analysis. We walked through a brand blueprint strategy. And she was all in, but we worked on this week by week, and she began to see more and more like, yes, this is how this is going to work. This is how this is going to come together, because you have so much to give to others, and we don't want these facilities to miss the ball. And we certainly don't want anyone to walk out of facility with some type of HAI, some hospital-acquired infection. So thank you again for championing the cause. It has been a pleasure working with you.
Same here. That is my superpower. I'm here for that.
I love that. Great way to end it. I encourage the entire audience to tune in to all the episodes of Follow the Brand at 5-Star BDM. That is the number 5. That's Star BDM. That's branddevelopmentmasters.com. Thank you so much.
Thank you.
Ready to build a 5-star brand that stands out and captivates? Discover the art of crafting a strong and memorable brand identity. From choosing the right colors to making your brand unforgettable on social media, we guide you every step of the way. Learn how to design a brand that resonates deeply with your audience, ensuring they not only remember but love your brand. Whether it's enhancing visual appeal or mastering social platforms, we have got you covered. Dive into the world of impactful branding with us and see the difference. Follow the brand for more insights and expert tips. Don't just be seen, be remembered. Join us now.
Who sort of understand the power of technology, but also understand that, healthcare, medicine, it is about people. We are in the humanity business. Well, look, I think mis and disinformation affects the whole industry, from the life sciences space, the med device space, the payer provider space. I think if we all tackle it together, there are ways to partner with life science companies, med tech companies, and patient advocacy groups, right?
Five-Star BDM, Brand Development Masters, is a professional consulting and advisory group keenly focused on business development services for the small to mid-sized business and entrepreneurs. Although every business is unique, they often share business development challenges that can be addressed through smart branding. Services include process improvement and operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our business and personal branding company has helped a number of professionals and organizations to optimize and grow. This results in more business, more opportunities, better reach, positive outcomes. Visit www.5starbdm.com today to learn more.
Tune in for our next show or click on our website at www.5starbdm/followthebrandtv. Thank you.